Thank you on behalf of the Colorado chapter of HIMSS for joining today's webinar on Global Health Equity Week. We appreciate you helping us celebrate and are so grateful for your participation always. Dr. Levy, I'll turn it over to you for a brief introduction and then we'll get started.
Yeah, so thank you all for being able to join. I know we all have lots of Zooms, but there's so much, healthcare IT going on here in our state that I think, part of what we can do with the Colorado chapter of HIMSS here is help to bring all these groups, to the table so we can hear about all the exciting sorts of projects. We're known in the country really as a leader in healthcare IT and very forward thinking in terms of our healthcare IT roadmap, and so we're going to hear about that shortly from Stephanie Bennet, and then lots of exciting work going on. We're going to hear from some work going on with True Healthcare around managing the elderly population and how they intersect with healthcare IT, and how we can bring them up to speed in terms of health equity. So with that said, Representative, I'll pass it off to you to share with us some updates. What's been on your plate recently?
All right. Well, thanks for having me here today. My name is Titone. I'm representative in House District 27. That's currently West Arvada, but after this year, it'll be a little different. It'll be Arvada and Golden and some northern Jefferson County, but that's neither here nor there. I'm still representing the people of my district right now, and some of the bills that I've been working on for the next session. I do have a couple bills that are actually healthcare related. Last year, I ran a bill on the right to repair, and it was a general bill that was for repairing electronic devices and gave consumers more freedom to be able to fix those things. We've decided to take out one of those parts and focus on the area of people in electric wheelchairs or wheelchairs in general. There's a backlog of getting parts and getting service to people who are in wheelchairs, and this is their primary mode of movement. So we want to make sure that we're working the bugs out of the process of how people can get their wheelchairs replaced or fixed or have parts available. And we've been working with the wheelchair manufacturers and service providers, as well as HICPUF, to find the best ways that we can help those folks with disabilities and mobility issues to get their wheelchairs fixed in a faster way. We don't want people waiting months to get parts or a battery or something like that because of these barriers. So this is going to be a real big push in the right direction to help folks stay mobile, because that's super important. I'm also working on another bill that will actually provide healthcare coverage for victims of torture. So survivors of torture, especially from other countries, don't have access to healthcare here in Colorado. So what we're working on is a way for those folks to get access to Medicaid and to have all the things that they need for their treatment, mental health as well as physical health. There's a lot of things that victims of torture go through, and they have a lot of needs. And if we want them to successfully reintegrate into society without this healthcare, it's going to be much more difficult for them. So this is a way for those folks, and it's not that many people. It's probably just like a few hundred people that might qualify for this. It's just the right thing to do because these folks have been through so much already. And we want to make sure we're taking care of those people who are very vulnerable right now. So those are the two healthcare related bills that I'm working on right now. I have a whole bunch of other stuff, kind of environment related, HOA stuff, which is always not a favorite topic of anybody, but I do it anyway. And then working on some another one, a couple different environmental bills, but that's a topic for another group. So I will pause there if there's any questions.
Sure, that wheelchair bill sounds very interesting in terms of, its applicability towards medical devices. So do you envision, is there going to be some kind of central tracking system to be able to identify parts, sort of supply management aspect to this as well?
Well, there's already some of that built into the process through HICPUF and the service providers. They know what parts go out. They track by serial number, but there's a lot of things that kind of get in the way, like prior authorization, which, if you've been in a wheelchair and it's your primary mode of transportation for many, many years, why should you have to get pre-authorization to fix your wheelchair? It should just kind of go through. So there's a few, things that we may be able to work out through rulemaking through the division. There's probably going to be some things that we're going to work out through legislation and, making sure that people have the ability to fix their chairs at home for simple things. We're trying to work out a process for that too, because if you can stock your own parts at home that are commonly broken or consumable parts, we would say, if people could fix those at home by themselves through an app using a technician to help them, let's do that. Let's make sure that they can get that wheelchair up and running, especially in rural areas where getting parts to people is very difficult to do, especially in the wintertime, even if you want to courier something over the mountains. Denver is the place where most of those parts come from. And for the folks in the mountains, that could be very problematic getting those parts.
Yeah, very interesting. So who would build such an app, or does that app exist, or that's what this legislation is about?
Well, yeah, the app, there's actually an app that the wheelchair folks have already. So they can use an app, and the person who has the wheelchair can use that app, and they can document parts, they can take photos of the things that they're doing, but they don't have that process built in right now, and we don't have a way to get people those parts up front. So these are things that we're working out with HICPUF now, is how do we make that happen? What are the barriers that the statute has currently that we can possibly work around by still staying within the limits of federal law, because there are federal regulations on wheelchair repairs. So we have to make sure we're staying within those limits as well. So it's a complicated issue, but we had a very productive conversation recently about how we can make this happen, and we're furthering those conversations to come up with the best solution that works for everyone.
Great, great.
There's also a question in the Q&A, Dr. Levy, regarding the torture bill. How is torture defined, and would domestic violence or sex slavery be included, domestic or international?
That's a good question. I'm still familiarizing myself with the definitions, and there are a couple different definitions that are used. There's a federal definition, and then there's a UN definition, and those are different. But what we're looking at is that if anyone is being helped by an organization that works with these victims, that they would be eligible through a program that we're going to create with those organizations in mind. So we're trying to figure out the best way to make sure that these organizations are vetted and legitimate organizations that actually do the work that they say they do. So that way we can make sure we're getting those folks the help that they need, that are really going through these issues.
Thank you so much. Dr. Levy?
Well, great. Well, thank you for being able to spend a few moments with us, and we're always happy to be able to catch up with you. Lots of interesting things going on. So if there's any way that Colorado HIMSS can help you move some of these forward, or you need any help from us, happy to be of service there. So otherwise, have a great rest of your day.
Great. Thanks a lot. We'll be reaching out.
Okay. Thank you.
Bye-bye.
So each year we also select as a HIMSS chapter an organization to pour some of our resources towards. And being that we're all now virtual for most of our events, we wanted to take an opportunity to allow the organization we've selected this year to give a brief introduction of what their services are throughout the state of Colorado. So without further ado, I would love to introduce you to Mars, who has joined us from the Maria Drost organization. Mars, if you wouldn't mind giving a brief introduction, we would appreciate it.
Great. Thank you so much for selecting us. So I'm Mars Holzapfel. I'm the Chief Development Officer here at Maria Drost Counseling Center. And I just want to thank you from the bottom of our hearts for selecting us. So we believe in mental health regardless of wealth. We provide counseling services to the everyday person who needs counseling, who maybe is underinsured or doesn't have insurance. Maybe they're on Medicaid or Medicare and can't find a good provider. And we're a true sliding scale. So we go down to $5 an hour. And we are available in person at our main center and also via telehealth. We partner with community organizations across the Denver metro area where we also embed counselors to reduce other barriers to access like transportation or mobility. So we're in places like Kavod Senior Living, Rose Andom Rose Andom Family Center, and we're partnering with Adams County. So we try to make as many barriers disappear as possible for our community members that need counseling. So we're not severe and persistent, we're not inpatient. We are simply just the counseling center for the you or me or our neighbor who might need it. We do serve the whole state. Right now we have 2 fellows embedded in La Junta, Colorado, and we're registered with 3 or 4 of the RAYs, the Medicaid RAYs. So we're trying to expand our payers so that we have the whole state covered. So we are available for that. And our model is really unique. We utilize graduate level interns and postgraduate fellows, so the folks getting hours for graduation or hours for licensure, and they're the folks deploying the services. They're out there on the front lines. We're also embedded in about 20 Denver metro area schools as well. So we do beginning through end of life care. We partner with individual practitioners who own their own business, and they exchange their time donation of supervising our interns and fellows. In exchange, they get reduced office space for rent. We provide them with clients that we might not be able to see. They will see a percentage of Medicaid clients for us. And it's a symbiotic model. They are really invested in ensuring that the next generation gets the best training possible to ensure that Coloradans have access to the best mental health possible. So that's a quick overview of us. And I want to thank you again. Are there any questions I could answer?
There was just a question about the name. So in the Q&A, I put Maria Drost Counseling Center. I'll also include a link to the website, and please look for some more information about Maria Drost and the organization as we continue to cross promote their services.
Thank you so much for your time today and all you do in the community.
Thank you so much, Mars. We appreciate you. Dr. Levy, do you want to take it away for our regular programming?
Yes, and thank you, Mars, for being able to share a bit about what you're doing. It sounds like really important work. So with that said, I'd like to introduce our first main speaker, and that is going to be Stephanie Bennet. Thank you very much for being able to join as our State Healthcare IT Coordinator. And looks like also Melissa. Thank you again. As I said at the outset, you know, our state is known across the country as really a leader in healthcare IT. So many of the other states reach out to us and saying, you know, how do you guys have a roadmap already? We're just starting to work on ours, and how can we move these sorts of things forward? And so to that extent, you've made our job easier at HIMSS because, you know, we're already ahead of the game. But as I said, what we can do to help you is to help get the word out so that folks know that we have this roadmap and know that they can use it. I know it's recently been updated, so we very much look forward to hearing those and also hearing how we can be helpful to you as well. So with that, I'll hand it off to you two.
Thank you, Dr. Levy. And you can see Melissa and I are in the same room and sharing an audio. So that is why Zoom looks a little funny. So my name is Stephanie Bennet. As Dr. Levy mentioned, I'm the State Health IT Coordinator and also the Deputy Director for the Office of eHealth Innovation. And Melissa?
Hi, good afternoon, everyone. Melissa Hensley. I am in the Office of eHealth Innovation, and my focus is on interoperability product strategy.
And thank you so much for having us today. We're delighted to be here to share our updates on our refreshed roadmap. And for a little bit of background, the Office of eHealth Innovation, or OHI, like OHI, is a state designated entity for all health IT strategy, policy, and funding coordination. We're a program located in the Lieutenant Governor's office, and our primary goal is to advance the Polis Primavera administration's bold health priorities and with the mission of building a Colorado for all. And so the eHealth Commission also advises OHI and the state and steers strategic roadmap initiatives. We'll go through our full roadmap process today. As Dr. Levy mentioned, we've had a roadmap for a few years now. The original one was finalized in 2018, and we've undergone a refresh of that state strategy this year, just this summer. So I'll start there. Oh, and I have slides to share that I'm not sharing with you right now. Let's see, hopefully. Oh, apologies for that. All right, now you have something to look at. So what I just went through, and one part that I did miss is we have guided over $50 million in health IT investments over the past 4 years. And so we do that through matching federal funds with the Centers for Medicare and Medicaid Services mostly, as well as other grant and funding opportunities. Melissa.
So the eHealth Commission reviewed and unanimously voted to approve a couple of weeks ago on October 13th, our draft health IT roadmap. And when this roadmap is approved, the eHealth Commission will prioritize initiatives, projects, and funding.
And how we got here. So we realized in the past year or so that our current now past roadmap didn't include a lot of things that are really important in the healthcare space today. And so it was time for a refresh. You can see a little sneak peek of some of the graphics on this slide. And to get here, we really wanted to make sure this was going to be a Colorado health IT strategy and not just an OHI strategy or Stephanie's strategy or something like that. And so we went in person to Eastern Plains Healthcare Consortium in Haxton, and then also to Trinidad this summer. Really wanted to get some face-to-face, safely, of course, interactions and make sure that we are building in a service to Colorado for all. We also held a couple of virtual meetings. You can see the dates there that were pretty well attended. And so thanks to any of you who were able to attend. Again, just to really circulate this proposed strategy and gain your input. We conducted an online survey. We also had a lot of conversations at the annual Innovation Summit that our office hosts every year in collaboration with Prime Health. And we posted a draft for public comment the week of September 13th and got a few great comments there as well. And the basis of this strategy was over 40 meetings with individuals in state government, our private and community partners, as well as the average Coloradan who maybe doesn't interact with health IT a lot, at least in a traditional sense, or I guess in a professional sense that we all do, but does, it's 2021, we probably all have used an app or a website to schedule a health visit. And so really, again, wanted to make sure that this was a state strategy that gained a lot of support and input.
Thanks, Stephanie. So some of the 2021 roadmap revisions. So the 2021 roadmap defines a vision for transforming the state's current, what I would call patchwork infrastructure, into a more cohesive and integrated system that enables inclusion and equitable access to data and information that can better serve, as Stephanie said, all Coloradans. So creating health equity requires eliminating barriers that limit opportunities to thrive. Creating digital health equity using health IT requires intentional effort to build digital inclusion. This means ensuring that all individuals and communities have access to technologies and the support and skills to use them. So we really had to think differently there. Achieving digital inclusion and digital health equity also requires intentional strategies and investments that reduce and eliminate those historical, institutional, and structural barriers to access and use of health IT. The 2021 roadmap calls for these needed strategies and investments. Next slide, please. So these are our 3 goals, and these roadmap goals were informed by the gaps in today's health IT infrastructure that were highlighted by the pandemic and identified by stakeholders throughout the entire process. And these goals are really around health equity, bringing healthcare to the patient, the person, whether that's virtual, remote, and information sharing. And as I said again, improving equity requires removing barriers that make it difficult for Coloradans to access, receive, and use their own health information. Coloradans also want to scrutinize, Coloradans also want to securely share their data and among trusted providers and organizations that support their health. Coloradans should be able to give and deny consent to allow providers, community organizations, payers, and agencies to access and share their data. All right, let's talk about some of the core values and objectives that really drove were the North Star of our roadmap. So Colorado's health IT policies, investments, and activities over the next 3 years will be guided by values that support state and roadmap goals. The Office of eHealth Innovation and the eHealth Commission, in collaboration with stakeholders and communities across the state that participated in the roadmap refresh process, identified the values that will drive the work. And these next 2 slides contain a list of these core values and objectives: accountability, alignment, equity, innovation, obviously being good stewards of resources and reusability, and most importantly, sustainability that justify long-term financial support. Stephanie, back to you.
Thanks, Melissa. And in service of the Global Health Equity Week, we really wanted to put a spotlight on our digital health equity efforts. And this is one of the newer priorities in the roadmap, and one that our team and the eHealth Commission has been working to build a foundation for, as we knew this was going to be a priority in our roadmap. And so part of that is access to broadband. You know, it's easy to take for granted. Those of us who have more than 100 MBS, whatever MBS, 100 up and down, and that's just not equitable throughout the state. Even within urban areas, there's hot spots and there's spots that it's impossible to get good broadband. And so we're working closely with the Colorado Broadband Office in support of the bill that was passed last year, House Bill 21-1289, which allocates $10 million to support telehealth throughout the state. And so we haven't received those funds yet. We're working on project plans to ensure that this is distributed to the households and providers that need it most. And that will likely be released through a grant program, likely early 2022. That also includes access to devices. So not everyone has a cell phone or a smartphone or a computer or a tablet that they can conduct telehealth visits or even do basic work from home. And so we have worked with our federal partners. In 2020, we received $2 million from the Centers for Medicare and Medicaid Services, CMS, to award that funding to 34 providers throughout the state. And one of those I really want to highlight today that consequentially we'll be talking next is True Community Care. And they were fantastic to work with, as were all 34 providers. But I think this is a great illustration of really meeting people where they're at. And they worked to procure GRAN pads, which are these tablets, which are specially formulated and geared toward older adults who were at risk of isolation, especially during the height of COVID. And as you can see, it's a little bit less complicated of an interface than maybe your typical iPhone. It's a little bit more user-friendly so that they can access telehealth visits. It has appointment reminders as well as medication reminders. And it also just enables them to call or video chat their loved ones. And so they had some really great metrics showing the impact that it had on this community, and just was a really neat story and a really creative solution to a population that isn't always top of mind for technology. And so just wanted to share that little highlight and know that we recognize that broadband and access to digital services and devices is a top priority for digital health equity. And here are some ways to get involved with our efforts. As I mentioned, as we both mentioned, the roadmap is recently refreshed. And so we will be kind of recalibrating a lot of the public meetings that we hold in order to best utilize our stakeholders' time. And that'll all be on our website, which I think is on the next slide. So apologies for that, but it's ohi.colorado.gov. And again, mentioning that broadband priority. So the broadband office has a survey out right now. That link will work, and I'm happy to send these slides to our Colorado HIMSS moderators here so that everyone has access to it. But that survey helps everyone in Colorado to decide, how do we want to propose to our federal partners how we would use capital funds for broadband? And so really want to emphasize everyone and your extended family and friends should take that survey so that we can decide together. We also have a few openings on the eHealth Commission. So please, that link is live as well. So that's a great opportunity to really help lead and steer the strategy. And it's not just for health IT enthusiasts. You could be a provider, you could be anywhere in the health or IT space. And in fact, we really want to have a diverse and inclusive commission. And so really encourage folks outside of the Denver area, as well as the Denver area, to apply to that commission. We're also hiring. We're really looking for smart and enthusiastic project managers and coordinators. So please contact me or Melissa if you are interested in that. We'll also have a posting on the State of Colorado job site, probably today. And here's our contact information. Happy to answer any questions. And again, I'll send these slides so that our HIMSS friends can distribute them.
Wonderful. Thank you so much. And I did put the website in the chat. You also got some props for whoever's managing the PrepMod COVAMAX environment for COVID vaccine clinics. This was a really useful tool for managing vaccination clinics and limited work for auto-populating. So thank you. And make sure you reach out to both Melissa and Stephanie if you're interested in joining the team. Dr. Levy.
Yeah, so thank you for that update. So just a couple of sort of questions. What do you foresee as maybe some of the challenges with this next update of the roadmap in terms of how to get the word out or how to get some of these initiatives actually moving forward?
Start and Melissa jump in. I think one of the challenges is that we have set some pretty bold and ambitious goals that we need to achieve by 2024. So that's a pretty short timeline, but I think now is the time for us to really be setting up what does success look like for these, audacious goals. And I think another challenge with that is honestly getting people to pay attention to this work and be excited about it. And so that's something that our office really focuses on, is what is the end value of this work to patients, providers, everyone in this space? Because I would imagine everyone on this call is enthusiastic about health IT, but not everyone in Colorado is. And so really translating the technical work or the policy work, and really both, to our friends and neighbors and saying, this is why you should care about it.
And to dovetail onto your comments, we really want to look through a lens on the end product to have a human-centered design, so that we want that voice of the customer. So if you're using services or health IT, get involved, and we want to hear from you what's working, what's not working, because that will help us move this work forward.
Yeah, and I think that dovetail into sort of the next point is, how can the Colorado HIMSS members help? And certainly one of them is to become involved, to apply for roles on the eHealth Commission. We represent obviously all the healthcare organizations here in our state. How else do you think we might be able to help you?
Yeah, I think that's probably number one, honestly. And also, again, just sharing your experience and your feedback. And we are privileged to be in the Lieutenant Governor's office and members of the state workforce, but we don't know what happens on the ground all the time. And so really bubbling those things up and saying, this is what we're seeing, this is how we need your support. And so really setting up that two-way communication is important, rather than us just saying, this is what we're going to do. We really do want it to be informed by that consumer and provider voice.
Right. Do you have mechanisms in place to sort of measure progress on adoption of the roadmap?
That is a good question. I would say that is exactly where we are right now.
Yeah.
Set these goals, and they are high level, and there aren't a lot of numbers associated with them, honestly. We do have our wildly important goals that we set with the governor's office, as do all state agencies, and those absolutely tie into these. But we're gonna need to expand those a bit. We do have currently wildly important goals around telebehavioral health, virtual health services, as well as health equity. And so with those, we have really broken it down into how are we going to achieve this, from a monthly goal to a quarterly goal to a yearly goal. And then actually each of those has been a 2-year goal. And so now I think most likely we'll take that framework and apply it to this roadmap as well. And so we are able to say, okay, what should we be doing this month, this quarter, this year, for the next 3 years to make sure that we accomplish this? And then again, what does that success look like based on these goals?
Yeah.
Great.
Align policy and funding and the services to achieve these goals. So there's 3 or 4 streams of work behind each of these.
Do have a chat sort of comment here. It says, please give a shout out to whoever is managing the Prep Mod Covamax environment for COVID vaccine clinics. So I don't know if you're all involved with that, but they commented this is a really useful tool for managing vaccination, the vaccination clinics.
That's great.
That's awesome.
Yeah, I don't think that's something we've been directly involved in, but we will pass that on.
Well, great. Well, thank you again for being able to join. We really look forward to being able to hear progress on the roadmap throughout the year. We always like having you be able to speak at all of our events just to give updates and keep our Colorado HIMSS members involved. And we'll certainly put a shout out to our Colorado HIMSS folks to become involved. And any way that we can help you, please reach out to us.
Thank you so much for having us. We look forward to working on this together.
Absolutely.
Thank you.
With that, and as you've heard, our next guest, Jim Woodard, is from True Community Healthcare, and is going to give us a great session on the Telecare paradigm for increasing access to the underserved elder population. Just sort of a plug on this side, you know, I still see some patients over virtual medicine, and I think, you know, when we first started to do this work, there was a lot of assumptions that most of the people who are accessing virtual care are just the young folks who are actually used to using these sorts of systems, and I would say that is just not true. Lots of elderly folks and older folks, you know, want to be able to access the telemedicine and become involved and interface with healthcare IT. So look forward to being able to hear about some of the work that you have been doing, Jim, in this front.
Thank you so much. I'm so excited to be here and tell you a little bit about our program, which was really an effort to engage our patients, which are predominantly elderly, in telemedicine and using technology because they are so, can be so isolated at times. So I'm going to try and share my screen here. So I'm going to walk you through a little bit about our journey in that and where some of our outcomes. So I am with True Community Care, and we really serve 95% of our patient population as our elders. And it's divided into these main kind of service lines. We do provide hospice care, home and inpatient hospice. We have a very robust palliative care program and a home health care program that partner with people along their journey with chronic disease to have them be able to get the most out of that journey. We have a PACE program, which is an amazing all-inclusive care program for the elderly, where we, in essence, take on all of their care, housing, medical, social. We supply all of that. We have a robust grief services program that we'll talk more about that works with people with anticipatory grief as well as individual and group counseling. And then lastly, and new for us, is we are now involved in residential memory care. We have a residential memory care facility where people actually are residents and we provide care for them in that setting. So just to give you a background, as we all know, the world is aging, and this is kind of some of the demographics that you can see for Colorado. And yeah, each layer is an increase in that population from 1990 through projections for 2050. And needless to say, we're going to be dealing with a lot more folks in this group, and they're going to need services. Layer on top of that, this really busy map from the Rural Health Information Hub, which in essence tells us there are not enough providers, especially as you move away from urban areas and you start getting out into the rural areas. It gets very difficult to find a provider that you can access. So layer all that together, and what we know from our patients, which I think has been played out across the country, is that folks want to age in place, and they want to do so maintaining as much independence as possible. And this can be a bit of a conundrum because as they do that, it's harder and harder to maintain that independence, especially in rural areas as children move out to seek employment and bigger cities. Often the elderly mom and dad are left behind to, in essence, fend for themselves. So we're really seeing this kind of all come together to form a barrier for elders to be able to access healthcare like others might. And it has been our belief that using telemedicine and some of this technology helps bridge that gap. Our journey began before COVID. We were actually headed down this road, especially in the population we were treating, seeing that we needed a new way to engage our clients. And so we, in October of 2019, selected the people that were our vendors, basically the folks that would supply the hardware and some of the tracking software. And so we did that, and then we began very intensive staff trainings in November of 2019 to make sure that our teams, our staff, our providers, our nurses, our CNAs were comfortable with the technology. And then we launched in December of 2019 with a whole 5 patients. And we did that on purpose. We knew it was a pilot. We knew that we were in uncharted territory a little bit because we were using telehealth in a very non-traditional way. And then lo and behold, the pandemic started and just about everybody got into this telehealth space in one way or another. So as we were ramping up, we were really wanting to focus on what our patients and families had to say. So we started a survey. Would you be interested in using technology? Are you comfortable with technology? And got data back from that. We talked to all of our referring organizations, whether it be a primary care solo practitioner or some of the bigger hospital healthcare systems who were referring patients to us. What were they looking for and what would be helpful? And I will tell you, the staff that work at True, they were invaluable, and they were so good at giving us feedback, both good and challenging, to make sure that we were not missing something. And then lastly, we use national best practice. And I'm going to take a minute to explain niche that you can see there. It is Nurses Improving the Care of Health System Elderly. It is a national organization based out of New York School of Nursing. And they really are doing cutting edge work with evidence-based practice in improving how we work with this population and getting the best possible outcomes. And often in healthcare, we're frustrated because we use a general adult paradigm and apply it to folks that are older, and the outcomes are often not the same, and that can be frustrating. And so Niche was a great partner in helping us decide what we wanted to get out of this telehealth intervention. So we collected all that data. And then we looked at how we were going to use the hardware. So I'll walk you through the 2 systems that we picked, because what we found is one size did not fit all. So the first tablet that you'll see there in the upper right is from a company called Vivify, and they were really kind of a pioneer for many years in providing kind of home monitoring and really letting us use some of that biometric data so that we knew how our patients were doing. So you can see the tablet on the right, and it has big buttons that folks can access. You can literally push the phone button and it will call into our organization, and you will get somebody who can help you with your issue. On the left, you will see we call them the peripherals, the things that go with the tablet: a blood pressure cuff, a scale, a pulse oximeter. We can include a glucometer, and if we needed to, a thermometer. All of those automatically download into the tablet and then are transmitted to our organization so that we can monitor patients and how they're doing. And then we, in addition to that, we knew we couldn't just deploy tablets. So we actually opened a Telecare center, and you can see a picture of that there, where nurses and social workers were available to interface with patients either by telephone or via the tablet system to help meet their needs. And that is staffed 24/7. And then for our PACE program, we found that the GrandPad that you heard about earlier was a great solution, because their needs were predominantly socialization. They were increasingly isolated. We were seeing this before COVID, and it was just highlighted, and I think became nationally known, the struggle that some of our elders were having with just being cut off from the world. So again, you can see the big buttons. It's real easy to just pick it up and use it. Very high patient satisfaction. Our patients love this tool, and it really lets them both interact with their caregivers and with their families, so that we can all have a good set of eyes on them and see how they're doing, and really identify times to intervene much earlier than we would if we had to rely on a traditional home visit or having them come into the clinic. So those are the systems that we ended up deploying. And after we got all that feedback and everything together, these are the interventions that we found that we were using the most. So we did traditional video visits. We did, we called them pathways, and I'll talk more about that in a minute. We did visits with their specialists, neurologists, pulmonologists, et cetera, that were sometimes very hard, especially for these isolated elders. They didn't get into those specialty clinics as often as they probably needed to. Lots of family visitation. We were even able to start using this to do virtual admissions so that we could get right in front of the patient, maybe in the hospital, so that we could get them home because that's where they wanted to be, not have to have our staff go into facilities that were many times on lockdown, and then free up that bed for other patients who were in need. We do a lot of patient reminders, which we'll talk about. We did some inpatient rounding on palliative care teams across the area here, and that was very helpful. And then lots of grief support groups, which we'll talk about in just a minute. So those were the kind of the key interventions that ended up coming out of our feedback systems. And so just to kind of give you an idea of how we're using this, of course, the video visits, we all know about those when you have a face-to-face meeting with your provider, but we're also having our nurse navigators talk with patients and making sure they have the resources they need. Our social workers have been using this platform in a very robust way to have, goals of care discussions and family resource discussions. Our chaplains have been using it. And we do some technical visits. So can we look at your wound? If the CNA's in there doing care and we notice that there's a wound, we could take a look at it. Pumps and drains, especially the pumps, they start beeping in the middle of the night, and under the old paradigm, we'd have to send somebody out on a 1.5 hour journey to go click a button on that pump. And now we're able to use the technology to have the family show us what's going on and walk them through how to hopefully correct that. That has been really powerful. And then another thing is we call them the pathway monitors, and they're a set of questions that are designed around a specific condition, whether it be COPD, CHF, dementia, and oncology, or some of the big ones. But sets of questions go out that really help us gauge how the client is maintaining in the home, and depending on their answer, it lets us know who we may need to maybe schedule an extra visit for, or do a touch-in phone call, or maybe connect them with their specialist to get some extra help in there. We've also newly developed a hospice pathway, which we had not heard of before, but we were finding that our hospice families and patients really were needing some extra interventions. And out of that came something that we're calling the E7 program, which is for patients who are entering the last 7 days of life. They often need more resources, and the families need lots of support. And we're able to use this technology to really give that in real time. And we're finding that that is has been met with wide acceptance. So we're excited to see where that goes. Again, that's a very new program, and we're going to be following that closely. We talked a little bit about socialization, of course, family visits, but we do online bingo groups, we do book club, we do birthday parties, and it really helped our clients feel connected to their peers in the program, as well as to have the staff be able to interact and just be a support. And that was using the GrandPad. Specialty visits have been huge, and I'll give you 2 quick examples. We had a neurologist who was dealing with a patient who was pretty remote, rural really, and that patient, because they had a neuromuscular condition, very rarely was able to transport it down to the medical center to see their specialist. So we were able to hook up a televisit, and the neurologist was able to discover that the patient was actually toxic on the medications, and they were able to adjust that dosage, and within hours that patient was doing better. And the family said they got to actually avoid the ordeal of a whole day of travel to go to a 30-minute clinic visit. And we also had a patient who was on a transplant list in a transplant team out of state, and we were able to make sure that we coordinated their care with the transplant team and the local care providers and ourselves, and were able to have that patient stay at home until they were able to get their transplant. And that closing that care loop was really powerful. And then we also do grief groups. We do one-on-one group therapy. We have a national participation in this. Many of these folks have found us online. We are open to all, and they're able to join our groups at no cost. And they're really, we actually saw that grow during the pandemic, which surprised me a little bit, because typically group therapy and one-on-one therapy is more of a, in-face process, but we did see that grow, and we're opening it up to anticipatory grief, and we are getting some good feedback on that as well. And then lastly, we do some general patient reminders. Reminders to take your medications are automatically scheduled in the telemedicine platform, and the patients get a nice notification of that if they have an upcoming visit. We also send out nutrition information if you're diabetic or facing some other health challenges, recipes, and just trying to make this an interactive intervention. So we are doing those kinds of things as well with the system. And then just to kind of give you an idea of the some of the patients' feedback on the telemedicine program. We had the gentleman, you can see the cabin here on the left, who prior to getting ill really enjoyed going up to his cabin. But as he became increasingly ill, he didn't feel safe going up there. We started our Telecare program. He wanted to give it a try. And he actually said, I think I want to take this to my cabin. So he was able to take his tablet, hook up with the Wi-Fi up there. And he said he got his life back, that he knew that his nurse was one button away, and that he wasn't alone anymore. And this gentleman was caring for himself. He didn't have family in the States, and so he was doing this alone. And I think this was a great example of how we can broaden people's worlds if we give them different connectivity. Another woman was really struggling with reminding to take her medications. When she took them, she did great and felt so much better, but she would often forget. So we used the telehealth intervention to remind her to take her medications, and she was very successful. So both her primary care and her specialty physician were seeing better outcomes. And then one of her personal goals with us was she wanted to stay hydrated. So we would also send out additional reminders to drink her water. And she tells that story to all of her peers in our program about how great that was. So just two examples of how this intervention, I think, has really helped elders who are isolated or prone to isolation get more connected. And then just some of our results for all of last year. You can see that our RN assessment, those pathway questions, our patients answered just short of about 80,000 of those, which really gave us a good idea of where they were at and how we could help. And then we saw our minutes of the nurse doing video visits with the patients. It just skyrocketed as well as people became more comfortable with the technology and how to utilize it. And then lastly, I think what we did correlate was in our palliative care program, when we rolled out the telemedicine program in January, we started to see an increase in our palliative care. And the feedback from our patients and referring individuals was that was a big difference in having these people really, increase their health and be able to stay independent. So quickly, some lessons that we learned. You're going to deviate from your plan, and so you should just know that. Our plan didn't look anything like what we had on paper when we started. That finding staff champions was really a key to success, because we have people that just are passionate about using this to help their patients, and that became kind of contagious, and then the other staff got excited about it, and then our patients were able to benefit from it. Our elder patients embraced Telecare. I mean, there were a few who were not going to use this technology, but the vast majority of our patients not only used it, but enjoyed it. And that was exciting to see. We learned this lesson over and over. Patients, families, and the people that refer the patients to us, they know best. And by listening to them, we were able to use some of these interventions in ways that we hadn't even thought of for better outcomes. And lastly, it was okay to fail. We had failures, we had mistakes, and we used those to learn, and we moved forward to help, I think, develop a pretty robust intervention for our elders. So that is the presentation.
Incredible work, Jim. Thank you so, so much. We appreciate it. I don't see any questions in the chat or the Q&A, but if you have any, please feel free to let us know. Dr. Levy, did you have any questions?
Of course, I always seem to have questions, right? No, this is excellent work, and as I said, it's so great to see us engaging this often underserved population here in our state. A couple of questions. Has broadband been an issue with your patients yet?
It can be. Now, we are lucky that our hardware does both cellular and the broadband. And so in instances where there's been trouble with one or the other, we've been pretty successful in switching over. I will say we've had a couple of rural patients who don't have any connectivity, and we've been unable to do this program.
Yeah, so I think that serves well into certainly what what our healthcare IT coordinator has spoken about. Increasing access to broadband is certainly particularly important in a state like ours, where there's lots of rural areas there. So it'd be great to be able to have all of our patients have accessibility, and you could say that our elder population in the rural areas are those that most need these services because they can't, drive an hour to obtain them anywhere else.
Right.
Are there legislative barriers that you're running into?
There have been, and actually some of the waivers with the pandemic have been helpful because we're able to have our providers do interventions that normally weren't allowed. And we are hearing that some of those barriers may be permanently removed, and that's a great thing. I will say, especially in the ambulatory setting, most of what we do is not reimbursed. We see it as improving outcomes and helping manage costs, which is ultimately a good thing, but we do not see reimbursement for these interventions. So we work with state, federal grants and our givers to help provide this service.
Yeah, in fact, that was going to be my next question. What is the overall funding model, and what do you see as some of the barriers there? And you just mentioned a couple of them.
Yeah. I mean, the technology is expensive, so especially the tablets and the software to do the interventions. I mean, there is a price to that, but we are always looking for models to make that remove that barrier and make sure the patients have access.
Yeah. And Stephanie earlier mentioned some work that you were doing with her office. Maybe you can tell us a little bit more about that.
Yeah. Our PACE program has been working with their office to really make sure that our PACE participants, which are elders who have no resources. So these are the poorest of the poor folks who really don't have much. And so we're able to bring them into PACE and make sure we engage them both in a psychosocial way and in a health outcome way and provide those services. And what you see is when you're able to get a person into a PACE program, they do better, they use less healthcare, and they have much longer productivity. And so it's a win-win. And without the state's office, we would not be able to use the grand pad intervention and make sure that we could monitor these patients. It really adds an additional layer of monitoring that we would have to do in person if we didn't have the technology.
Oh, that's great. Because I have one final question. Are there technical barriers to this population using some of the IT, or do you think that they adapt to it pretty quickly?
I mean, I think it falls into two main buckets. The folks that we're seeing, especially, as folks have grown up with technology now that are aging in, they're used to it, they love it. And then you have another group that maybe was on the periphery of that, and with a little bit of additional coaching, they become comfortable and love it. And then there's the last group that maybe a little bit older and didn't have much technology or couldn't afford technology. We spend more time coaching them. Ultimately, we can get there, but it's a longer journey.
Great. Yeah, and I think that's what I'm saying. As I said, I do telemedicine through one of the national telemedicine providers, and increasingly we're seeing elder patients, and these are folks who are complicated. They're calling into sort of basically an urgent care saying, I'm on 10 different medications. I need medication refills. And that's not something we can just readily do in a quick urgent care visit. How do I make sure their blood sugars are okay? How do I be able to follow up with them? Or these folks call and say that they've fallen and they don't know where to go, or should they go to the ER? And so being able to have, it's not just the initial visit, but it's the follow-up and the sustainment that you offer that's so important.
Yeah, we find that it's that follow-up that really has been the gift, seeing patients over time.
Yeah. Well, with that said, are there any questions from the audience? Any other questions from the audience at this time? Feel free to put them in the chat. I don't think I see any at this point. I do want to thank all of our speakers for spending some time with us. We'll make this recording available to Colorado HIMSS folks who are not able to attend to learn more about all these great things that are going on. And this is part of HIMSS Global Health Equity Week. So we appreciate you spending some time with us to learn about these activities.
Thank you for hosting, Dr. Levy. Thank you all. We'll be following up with a survey. Please provide your feedback, and we'll provide the recording on our webpage. Thanks so much.
Thank you all. Have a great rest of your day. Bye-bye.
Thank you.
Thank you.